Joining us now, though, is Elaine Parker. Elaine is the Senior Vice President of Communications and the spokesperson for the Job Creators Network. She's also president of the Job Creators Network Foundation. And we got a lot of good things coming out from the Job Creators Network, Flatten the Fear being one of them. We still got that going on rampant. And Elaine joining us now. Elaine, great to have you.
Hey, John, how are you?
We got a lot to talk about today. You're in Florida. The fake news narrative in Florida is unbelievable because you look at your hospital rates, they're way down. You've got 80% of bed capacity. Ventilators are in storage bins. They're getting shipped out to other countries in Florida. You don't need them. The death rates have come down. Testing is up, but cases have come down. And yet, if you go to any of the fake news media, they keep telling us that Florida is a COVID catastrophe. What is going on in Florida, and why the constant lies?
You know, I don't know why there's lies, because this is about putting things into context. And yes, we do have an increase in cases here, but when you look at the death rate even in Florida, compare it to New York, I mean, the amount of deaths they had was about 5 times more than what Florida's dealing with. And actually 82% of all the deaths in the state of Florida are from people over the age of 65. So they're happening in a very specific age group, a very vulnerable age group, those with comorbidities or underlying health problems. But the other thing that really skews the numbers for people is that hospitalizations, because when they just report that hospital ICU beds are at 80% or 85%, so what are they normally? What are ICU departments normally running at? They need to run at near capacity or full capacity to function normally. If we have doctors and nurses sitting around because we're at 20% capacity, guess what happens? They go home. They lose their jobs. Hospitals don't function unless they are at capacity or close to capacity. So many of the ICU admissions, in some cases as much as 75% right now, are not even COVID related. They're actually people who couldn't get services and some of those essential surgeries that were banned during the quarantine. Those people are actually sicker now. Imagine that.
The hospitalizations and the lack, or what they say in Florida, that ICU beds, they give that number, they say it's up whatever percentage. It's up because people couldn't get anything done for months, and now they're getting things done. Some of them are going as you, but it has nothing to do with COVID.
It's not necessarily all to do with COVID, and that's what the media isn't doing and putting it into context. They're also not putting into context what an ICU department really needs to run at to function normally and help us understand. Well, normally they run at 80% capacity. Now they're at 85% capacity. So it would help alleviate people's fear if they understood what normal is versus now. Mm-hmm. And all of the hospitalizations that we're seeing across the country are not all COVID patients. They are other patients. They are people coming back to the hospital to get the services. I mean, what you have to understand is diagnostics were not being done. Cancer screenings were not being done. Heart valve replacements were not being done. Mastectomies were not being done. All of those people, those are called elective surgeries, believe it or not. All of those people either got sicker or they needed to come back to the hospital to get these surgeries and procedures done.
So if your normal ICU rate is 80% capacity and now you're at 85%, really you've had a 5% increase due to COVID. But what they say is 85% of ICU beds. They don't clarify it. That's why we call it fake news, because what the fake news does, I keep putting this into perspective. You know, we say fake news. What they do is they selectively report only on what they want you to think to buttress their narrative. That's it. So they're not saying, well, actually, hospital ICU beds due to COVID are up 3%. No, they're saying they're at 85% capacity. 80% of them are there anyway in perpetuity, because that's what hospitals are set up to do, be at 80% capacity. But yet what you see in the headline is 80% people are dying, and we're going to get body bags in cul-de-sacs to completely stoke the fear. And, of course, the Job Creators Network campaign has flattened the fear because, look, if you look at all the hype that's been going on there with the Florida Marlins, Elaine Parker with us, 15 people have been infected. They have COVID. They're sick. The games got canceled. Every single Florida Marlins player and staff member that has COVID-19 tested positive. Every single Florida Marlins player is asymptomatic. Every Cardinals player is asymptomatic. Every player in Major League Baseball that has tested positive is asymptomatic. So basically what this means is if you didn't have a test, you wouldn't know you had it. So yet what we hear from the fake news is that, oh, my God, Major League Baseball might get canceled because 15 Marlins have COVID-19. What they don't tell you is all 15 are asymptomatic, and had they not had mandatory testing, would not have any idea they had it.
So, John, it's interesting. This COVID-19 should be taken seriously, and it does warrant taking precautions. And we do want to continue flattening the curve, but we also want to flatten the fear. We do need to do physical distancing and hand washing, and when you can't physically distance, wear a mask. I stand behind all that. But the virus, while it's not the common cold, it's also not the bubonic plague. And I will tell you, my family has been impacted this week directly by COVID-19. My sister was tested positive down in West Palm Beach, Florida. But she has had essentially the symptoms of a cold, of a chest cold. And, she's feeling fine. She's a little bit tired. She did not know that she had it, except that she had this chest cold that wasn't going away. And, of course, she tested positive. She's doing just fine, though, and she's going to recover just fine.
As are 99% of the people that get this are going to recover fine. And those that are vulnerable or over 65, here's another fact that you brought out, Elaine Parker, that nobody else says. In Florida, 82% of the deaths are over 65 with underlying health complications. 82%. So, I mean, that is a stunning number. So basically, the only people that have died from COVID that are under 65 without underlying health conditions, that's 18%. So if you take an 18% number, that is on a par with common influenza. And yet we're destroying the entire economy and not educating our children over this. What's going on with schools in Florida, Elaine?
So Governor DeSantis, I think, has done a fantastic job, and he's made it very clear that he wanted parents to have a choice. And I've decided for my family that my daughter is going back to school. She wants to go back to school. She wants to have normal, but you can, as a parent, decide to do distance learning with your kids. I don't necessarily agree with it. I think that the studies and all of the data bears out when we look at what's happened in Europe, the Netherlands, France, Germany. They went back to school. They didn't have any big spreads. They've looked at middle-aged kids, middle school and elementary school kids, and they did not see a spread. Some scientists actually believe that the kids may act as a brake on the virus, but they are not seeing high transmission rates from children to adults. And you know what, John? I think with all the proper precautions put in place, we can get kids back to school. I mean, we did a national petition about 2 weeks ago during, the height of all of these arguments on deciding how we were going to go back to school. But we did a national petition. Over 2,000 doctors signed this petition in favor of going back to school for face-to-face learning. And when you look at the CDC guidelines, the American Academy of Pediatrics, all of them are in favor of making the goal for children to be in face-to-face learning. And with proper precautions, we can do it. We've made grocery store cashiers essential employees. When are we going to make teachers essential employees?
When you ask that question, it almost sounds surreal. Of course, the answer is obvious. They should both be essential employees. But you're right. The position that we've taken in schools is so political. And you as a parent, right, you want to make the choice as to whether or not you want to send your daughter back to high school. in September, right? You want to make that choice whether she goes to school physically or she stays home on some kind of an internet-based learning program, which is unproven. And I had a former teacher on a little bit earlier, 7:30 hour. Kirk Cox, former speaker, taught high school, and he said what's even worse in the fall. He said in the spring you had a relationship with those children, like you know who was in your class, you know what some of the issues are. He said you go into the fall with distance learning or reimagining education or whatever they're saying is you don't even know who these kids are, right? You didn't have them in class, so you have no history of them, so you don't know how they're learning or not. The whole thing is absurd beyond belief. But we continue to do it, and our children being used as political footballs. Crazy.
Yeah, it's actually it's really sad with the distance learning because when you're keeping kids cooped up at home, you've got isolation that can delay emotional and social development. And especially for kids with learning disabilities or who are autistic or on the autism spectrum, who require that face-to-face interaction to learn. I mean, my nephew is autistic. He has to have that face-to-face. But then there's the more serious issues where physical and sexual abuse of children go undetected because, teachers can be that first line of defense to detect an issue with children in the classroom. Then there's 22 million kids across the country who depend on those free and reduced lunches. Many times those are their only meals per day. So you've got a lot of societal costs to keeping our kids out of school. And that's before we even talk about just the issue of parents can get back to work if their kids can get back to school and the economy starts to recover.
Well, the Democrats don't want you to go back to work. That's why they're pushing for $600 a week continuation of extended unemployment beyond what you get from the state. That's why they don't want the schools to open. I mean, all this ties to one thing, and that's the election in November, to keep people at home, don't get them any jobs, keep them dependent on the government, do mail-in ballots, have COVID, stoke the fear so we can just flood your neighborhood with ballots with no postmarks on them so that if they can't win legitimately, they can go ahead and steal it. That's what this whole thing is about. There's people in the media like me that's been saying it since April, and now it's bearing out because facts don't matter now. Science doesn't matter. Data doesn't matter. All that matters is getting rid of Trump. And I really think, Elaine, I got up the other day and started looking at some internal polling numbers that I've got access to, and all of a sudden, Elaine, everything's starting to turn Trump's way. He's staying on message. The Florida thing is now under control. Finally, there's enough media outlets out there trying to tell the truth. Parents are starting to get pissed off over this whole thing. You can just see it turning. The other thing is, and I got this from Alfredo Ortiz the other day, there was one internal poll. The president could get over 40% of the Hispanic vote in 2020. Is that that's a staggering number? Some internal polls we saw he was at 38%, and the crosstabs saw him going up. He could get over 40% of the Hispanic vote.
I think that's incredible. And Alfredo has always been very bullish on that. He's always been predicting that the president would do very well with the Hispanic community. It's an entrepreneurial community, and they have benefited. That community has done very well under this president and the policies that have allowed them to really prosper. And like I said, they're just such an entrepreneurial community that I think they really understand these policies and how they've benefited from it. I mean, talking about the lowest unemployment rate in the Hispanic community ever since we started keeping record prior to COVID. And you could say that about every demographic across the board. And that's, of course, all BC before COVID. But we can get back there because all of the underlying policies that exist are still there. We just have to get people back to work and get back to some normalcy while still taking precautions, and get everybody back to work, get the economy roaring again, and find some normalcy. I mean, people need to get normalcy back in their lives and their schedules, and to flatten that fear and to feel better about engaging in society. I mean, the societal costs on all of this. It's not just economic, John. It is definitely, it's about life versus life, not life versus the economy. I hear all these news reports about how, Republicans only care about the dollars and the economic costs. Well, I mean, we can talk about non-economic costs from a societal standpoint all day long, and I'll never touch on money because it's been so great overall, the overall cost. And that's why you can't just look at COVID and the COVID cost. I mean, like I said, there are millions of people who didn't get cancer screenings. It doesn't mean they don't have cancer. They just didn't get detected. What's going to happen to those people a year from now? These people are going to be victims of COVID, even if they've never even had the disease.
The payback for all of this, whether it's societal, mental, emotional, education, learning, income, jobs, businesses, the lockdown mentality, and a lot of what's been done, Elaine, is affecting us in so many ways, and it's all going to come back on our head, right? All this stuff manifests itself, and what has really got me fried is that the majority of what we're doing, we should never have done. It makes no sense, and it's all political. It's all about winning an election in November, and the fact that we're not educating an entire generation of children to win an election is the governors that are doing this are just sick. The school board members doing it really should be ashamed of themselves. I mean, I live in Chesapeake. We got 9 Republican school board members. 6 of the 9 voted to shut down schools. 6 of the 9. They wouldn't even allow for the alternative proposal in Southeast Virginia and Chesapeake, Virginia, which was you go to school if you want. If your parents want you to go to school, you have it. And if they don't, then we'll do the best we can with online Zoom or whatever, but you have the choice. They wouldn't even give parents a choice. Why? Because they're scared. Why? Because people gang up on them on mob social media. And so you got 6 Republicans caving and shutting down school out of fear of what the mob on social media might say about him. See that? You know what I call that? Cowardice and sick, right? Because now your kids can't get educated. And it's happening all over the United States. And I agree. Quite frankly, I mean, all these people, those 6 people, I live in Chesapeake, I would never vote for them again. I'll vote for anybody but them. I'm done with this. This is why Trump is going to win again, because there's that silent majority. We talk about it, Elaine, but it's real. And it's people looking at this and saying, I can't get my son or daughter educated. I can't go to this store without 8 masks on. All these things I can't do. And there's no science or data that backs any of it up. Why is it happening? Politics.
I agree, John. I agree. And I am hearing from people in other states. One of the doctors who's part of this Flatten the Fear campaign with us, she's in Texas. She's a physician. She's also on the school board. She said that they were given a choice by the governor, and they voted to offer distance learning or in person. 90% of the students in that community are going back to school for face-to-face learning. 90%. In my daughter's high school here, 30%. And we have 4,000 kids in my daughter's high school.
So 70% are staying home.
70%.
What do you attribute that to?
The fear.
70% are staying home. So that's where the Democrats feel comfort, because they've done such a great job in scaring people that even in your high school, given the option, 70% of the kids, of the parents, right, because it's not the student's decision, they're minor children. So 70% of the parents decided, I'm going to forego an education and not I'm going to keep paying taxes, paying the teachers, and I'm going to forego my education for my child out of fear. Incredible.
Yeah, and if you think about it, John, if you've got a high schooler, you can, they tend to be able to work a little more independently. Many high schoolers can. But if you've got a middle schooler, an elementary schooler, a 9, 10-year-old, they can't stay home and work independently. So our focus has really been, we want all kids to go back to school, but specifically we want the elementary and middle school kids back into school, because we're talking about social development here. We're talking about learning things that they wouldn't necessarily learn. And of course that allows parents to get back to work. So there's a double win there in getting back to normalcy. But yeah, I definitely am seeing more high school kids opt to stay home and do distance learning.
I just saw this come over the wire. After 6 months without lockdown or doing anything, Sweden's COVID-19 deaths, infections bottom out. So they went to herd immunity, and I guess that worked. But there's now evidence coming out that's saying areas that had zero lockdowns did nothing. No economy, no school getting ripped out from under you, no canceling soccer games. They did nothing. They're at the exact same rate that we are, or lower. And so I'm telling you, if there is history when we get older, there might not be. According to this state senator in Chicago, he wants to get rid of teaching history. But if there is history, history is not going to be kind to what has happened here in the United States with his fear-mongering all over winning an election. Unbelievable. Elaine, we're out of time. I want to thank you for being with us. Go to flattenthefear.com. That's flattenthefear.com. We got another huge project coming out. Let me tease it. It's called 10 for 20. Elaine's going to be talking about that next week. It's very exciting. 10 for 20. It's the pathway to Trump victory in 2020. 10 for 20 coming soon. Don't forget, go to our newspaper, launching August 17th, thevirginiastar.com. Sign up for the free alerts. Elaine Parker, Job Creators Network, thanks for being with us.
Thanks, John.